If you're a man over 40 and you feel tired, weaker, softer around the midsection, or just not like yourself, testosterone might be part of the story. But here's the thing. Low energy does not automatically mean low testosterone, and TRT isn't the quick fix many clinics make it sound like. Today, we'll break down exactly what TRT is, when you truly need it, when you absolutely shouldn't take it, the pros, the risks, and the natural steps every man should try first. Let's start with what testosterone really does in a man's body after 40. After 40, testosterone slowly declines, typically 1% per year. But the real issue isn't the number itself, it's the symptoms that come with a drop in bioavailable testosterone, the portion your body can actually use. Testosterone affects far more than libido. It influences your energy, muscle maintenance, body composition, confidence, mood stability, red blood cell production, even how well you recover after workouts. It's one of the key hormones that helps men maintain vitality. But here is the part most men misunderstand. Age itself isn't the problem. The problem is the combination of modern stress, poor sleep, extra belly fat, alcohol, evening sugar, and years of sitting. All of these can suppress testosterone more than natural aging ever will. And a lot of men panic when they see a total testosterone number that looks low, without understanding that total testosterone doesn't tell the full story. Free testosterone, SHBG, estradiol, LH, and FSH matter. Morning testing matters. Symptoms matter. Testosterone can absolutely decline after 40. But not every decline is dangerous, and not every decline requires medication. That's why the next chapter matters. TRT, testosterone replacement therapy, is exactly what it sounds like. Medically supervised testosterone given to men whose bodies cannot produce enough on their own. Most often, it comes in the form of injections, gels, or pellets. These are not supplements. These are prescription hormones that change how your body produces testosterone, how it regulates it, and how other hormones behave alongside it. When you start TRT, your brain's natural testosterone production slows down or shuts off. That means TRT is often a long-term commitment. Many men feel amazing in the first few months. More energy, better libido, increased strength, because you're restoring a hormone your body was missing. But TRT isn't just about boosting testosterone. It changes hematocrit, estradiol, cholesterol patterns, sleep cycles, and even fertility. That's why you need regular blood work, proper dosing, and a doctor who understands men's hormones, not a clinic chasing subscriptions. TRT can be life-changing for the men who medically need it, but it can be unnecessary, risky, or even harmful for those who don't. According to major endocrine societies, you need 3 things before TRT is considered appropriate. 1. Clear symptoms. Fatigue alone is not enough. You need multiple, consistent low T symptoms such as low libido, erectile difficulties, loss of strength, reduced morning erections, depressed mood, unexplained fat gain, reduced motivation, difficulty recovering from exercise. 2. Consistently low blood tests. You need 2 separate morning blood tests before 10 a.m. showing low testosterone. One reading isn't enough. Illness, poor sleep, alcohol, stress, or a bad night can temporarily crash your testosterone. 3. Hormonal pattern that makes sense. Your LH, FSH, SHBG, estradiol, and prolactin must be checked. This tells your doctor why testosterone is low. Is it testicular? Is it pituitary? Is it lifestyle-driven? If your free testosterone is genuinely low and symptoms match, TRT may help restore normal function and quality of life. But here's the key. TRT is not prescribed based on symptoms alone, and it's not prescribed based on numbers alone. It's prescribed when both line up. That's the difference between medical therapy and marketing. Many men think they have low testosterone simply because they feel tired or unfocused. But here are the most common situations where TRT is not recommended. 1. Your testosterone is normal, but you feel bad. If labs are normal, TRT won't fix the root cause, usually poor sleep, stress, overtraining, or diet. 2. You haven't tried lifestyle fixes yet. Belly fat, alcohol, and poor sleep crush testosterone more than aging. If these aren't addressed, you may not need TRT at all. 3. You're trying to have children. TRT can reduce sperm production dramatically. Many men don't realize this. 4. You have high hematocrit or untreated sleep apnea. TRT can worsen both, increasing risks. 5. You only have one low test reading. You need 2 valid tests before any diagnosis. 6. You're chasing high T instead of healthy T. Normal testosterone doesn't need medication. Higher isn't always better. Many men jump into TRT because they think it's a shortcut to feeling younger. But if lifestyle, stress, sleep, and nutrition are the real problem, TRT can mask the issue instead of solving it. For men with real clinical low testosterone, TRT can be genuinely transformative. Science shows potential benefits, including improved libido and sexual function, more consistent energy throughout the day, increased muscle mass and strength, reduced visceral belly fat, better mood stability and confidence, enhanced insulin sensitivity, improved bone density. These effects happen because you're restoring a hormone your body needs for normal function, not boosting it into bodybuilder levels. Many men describe TRT as getting their old self back. Not superhuman, just normal again. When done properly and monitored by a skilled doctor, TRT can improve overall quality of life, especially for men whose low testosterone is causing serious symptoms. But, and this is important, TRT is not magic. It does not remove the need for sleep, training, good nutrition, or stress management. In fact, TRT works best when combined with a healthy lifestyle. TRT isn't harmless. It has real medical considerations, which is why proper supervision matters. 1. Fertility reduction. TRT can significantly reduce sperm production. Many men are surprised by this. 2. Increased hematocrit. Thicker blood can increase cardiovascular strain if not monitored. 3. Acne or oily skin. Some men experience breakouts, especially early on. 4. Potential worsening of sleep apnea. If you already have sleep apnea, TRT can make it worse. 5. Long-term commitment. Your body may reduce its own natural production, meaning stopping TRT can be difficult. 6. Mood swings if dosed incorrectly. Too much or too little testosterone can cause emotional fluctuations. 7. Cost and monitoring. Blood tests, appointments, and medication require consistent follow-up. TRT is safe when done correctly, with controlled dosing and regular labs. The risks rise when men self-medicate, use unregulated products, or work with clinics that prioritize subscriptions over patient care. This is why the decision to start TRT should never be rushed. Before considering medical therapy, there are evidence-backed steps men over 40 should try to naturally support their testosterone. Lose belly fat. Visceral fat suppresses testosterone and increases estrogen conversion. Sleep 7 to 8 hours. Sleep deprivation can lower testosterone by 10 to 30% in a single week. Strength train 3 times per week. Compound lifts are linked to higher testosterone balance. Reduce alcohol, especially nightly drinking. Alcohol interferes with testosterone production and recovery. Fix vitamin D and magnesium levels. Many men over 40 are deficient. Both play roles in hormone regulation. Prioritize high-protein nutrition. Helps maintain muscle and stabilize hormones. Manage stress. Chronic cortisol competes with testosterone at every level. These steps alone can significantly improve how you feel, even if your testosterone stays within the normal range. If you're a man over 40 and you think low testosterone might be affecting your life, the first step is simple. Get tested. Not by a clinic that pushes treatment before understanding your situation, but by a qualified healthcare provider who looks at your whole picture, symptoms, lifestyle, and full hormone panel. TRT can be life-changing for the men who truly need it, but it's not a shortcut to youth, and it's not a substitute for a healthy lifestyle. The goal isn't to chase high T. The goal is to restore healthy levels and build a body that supports long-term vitality. Start with the fundamentals: sleep, strength training, nutrition, stress management, and maintaining a healthy weight. These are the levers that control your health after 40, with or without TRT. And if your labs confirm that your testosterone truly is low, then and only then should you consider TRT as one piece of a bigger strategy to thrive in your second prime.
If this video helped you in any way, even one small change you'll try tonight, leave a like. It tells the algorithm to show it to someone else who might need it. And if you want more clear, science-backed ways to protect your body and sharpen your mind after 40, stick around for more. Your second prime isn't about going back. It's about staying sharp, steady, and strong.